Welcome to my YouTube channel, Doc Nature Lover. If you like this channel, please subscribe to my channel and please don't forget to hit on the bell icon. I will be talking about flu, as you probably know from the heading of the topic today. It's a very common problem that we have come across. So, what is actually the flu? And what can we do to prevent it? And what can be done once you have the flu? With these few questions in mind, I have kind of jotted down a few things that I'm commonly faced by people or patients who ask me how to prevent the flu. I think this is a very important topic of discussion because every year thousands and thousands of people are hospitalized or they go through a lot of trauma from the flu, and actually it causes death and other illnesses associated. So today's topic, if you guys like and enjoy, please do not forget to write on the comment below. I will be using my reading glasses because without my reading glasses, a lot of my subscribers know I'm kind of blind. It was a long day at work. I just came home. I had planned to do this last week, but I couldn't do it because there was a lot going on. So definitely I wanted to complete this topic today. I'm going to try to stick to a pattern. That's why I have jotted down my thoughts and questions that I commonly get. So what is flu? Because we commonly get two questions. One is the respiratory symptoms, which is respiratory flu. The other is stomach flu, in which you get vomiting, diarrhea, nausea, symptoms like that. Today's point of discussion is really the respiratory flu. The respiratory flu season starts around September, October-ish. Usually it peaks between November to February, but you won't believe me, last year I saw the last flu case even in the month of April or May 2019. And I was surprised that, like the flu shot actually had worked really well in the first few months of the flu. But later on, we saw a lot of flu cases were reported. And that brings us to a very important question, which is, how do you know you have the flu? Because you're going to have symptoms of having common cold. Like, why would you think that it's actually the flu? So what happens is, to differentiate between a cold and a flu is, if you have a cold, you're going to have sneezing or coughing. But during flu, this is exactly as patients describe. Or I will hear this: I was hit by a train. I felt body aches, which was unbearable. I couldn't walk anymore. It's more kind of not a gradual process. It's sudden. It occurs suddenly. And that is where you know that I am very sick. I have got the flu myself. And I know how it feels like. So even an hour or two back, I was fine. And suddenly you have a temperature of 103, you have fever and chills. So to differentiate between a regular cold or a flu, the best thing is to see how the symptoms are occurring for you. Is it getting worse, or you just have like a little bit of malaise? The incubation period for the flu virus, actually, after you get the flu, for a day or so you may not have any symptoms from it. And then after 7 to 10 days, again, you can continue having symptoms of flu. So that makes it difficult. It's very interesting to understand how flu is transmitted, because if we understand that, we can prevent the transmission of the flu. And that is why my main job in educating my patients is how does flu occur? Flu occurs by droplet spread. So if you sneeze on your hand, or if you're coughing and you're coughing on your hand, instead of that, you take a tissue and you cough on that or you sneeze on the tissue, your chance of having symptoms getting worse or giving it to someone goes down, because the moment you're sneezing, you're spreading all these germs around, and that is exactly how the flu spreads. Now, there are two types of flu. Of course, there are various types of flu strains, but usually the two types of flu we see is influenza A and influenza B. There is a flu test that can be run in the office. So when patients come in, we do a nasal swab test and we do the flu test, and we will be able to tell if it's flu A or B. The sensitivity and specificity of the test run somewhere between 70 to 80%. So it's pretty accurate, not completely accurate. However, if I'm suspecting that this patient has flu, I'm going to take care of this patient. After 20 years of being in medicine and being an internist for that long, you are not just banking on a small strip of test. You have your experience, your knowledge, and you're going to treat accordingly. Going to the next question, vaccines. I cannot stress enough. I commonly get asked when I offer a flu vaccine to a patient or people is, oh, I don't want to get the vaccine. That will cause me to have a flu. No, it's actually a misnomer. Flu does not cause a flu. The flu shot that we give is a dead or deactivated virus. A dead or a deactivated virus cannot cause a live illness in anyone. The only way you can get flu from a flu kind prevention is the flu mist that is given in children 6 months and above. I don't even order flu mist in my office because I do not want even to go into those complications. I order two types of flu shots. So age below 65, they get the regular flu vaccine, and then 65 and older, high dose flu vaccine is given. These are dead viruses. Again, they cannot cause a flu for a patient. What symptoms they are experiencing could be chills or a slight temperature, like a little bit of 100 or like 99.4, 99.6, and you can take Tylenol for that. You're not going to get a flu. And this is a very big myth, because this is told by people and they discuss that amongst the friends, and they would say, you know, I wanted to get the flu shot, but my family member said I'll get the flu. You cannot get the flu from a dead vaccine. So please confirm that, and any citations I can give you that it cannot be possible for a dead virus to create the flu. Effectivity of the vaccine. Every year it differs how the flu vaccine is effective. Usually average we have seen 60 to 70% effectivity during the flu. The next question is symptoms of flu. What symptoms are you going to have? You're going to have fever, chills, runny nose. You will feel stuffy, a severe malaise, and as if the feeling of you being hit by a truck. This is exactly what your symptoms are going to be. If you feel that those are your symptoms, it's very important that you pick up the phone and call your physician so that you can be checked for flu. Because if we can diagnose the flu and start the treatment, your duration of the illness can be reduced significantly, and I really mean it. The duration of the flu can be reduced significantly by use of antiviral medication. Before the advent of the new medication, one dose, which has come out for the flu, we used to have a 5-day course of the flu, or people who are in contact with the flu, we used to give a 10-day course to prevent the flu for contacts. However, now with the one dose of the flu, the medications of Fluza, which I will list below, has been approved by FDA and we have been using it quite a bit. So it's only one dose. patients will say, oh my God, I cannot believe it. One dose and I'm like, I feel completely better. So it's just a phone call away, and I know that the phone calls during this time peaks, goes up and beyond. Nurses cannot manage the phone calls during the months of October, November, December, January, because this is the season when people are feeling sick. Lots of sickness is there. You cannot be able to diagnose this condition. If you cannot reach your doctor, please go to a urgent care or a specific clinic where, or after our clinics, or if you have children, especially elderly people and children are highly susceptible. The other very important thing about flu is people who are highly susceptible to flu are immunocompromised patients, patients who have HIV, patients who have other kind of autoimmune diseases, lupus, or they have heart disease or stroke or kind of active infection. Those are the patients who are highly susceptible. However, any of us can get the flu and can get very, very sick. A lot of times, a lot of patients would say, oh, I don't get sick from the flu. And that year, the flu hits the patient and they feel terrible, and they will come back and say, I want to get the flu shot from next year onwards. We could prevent the flu from happening. So please make sure that if you are having the symptoms, do not go to office, do not go to work, because when you go to work and you sneeze, you are actually giving the flu to so many other people. And on the CDC website, if you go there, and I'll try to link below the CDC website, this gives county by county cases or rate. I follow these cases throughout to see, what's going on. How can we prevent the flu? I think that's a very, very important question. One of the very important things that I always tell my staff, and my staff knows very well, is to keep the flu area or the sick area separate from the general patients. So there is a distance so that the patients who are sick, they are sitting in the sick area. Patients who have come for regular visits, who have their coronary artery disease check, blood pressure check, diabetes check, cholesterol check, they are sitting in a separate area. So there is definitely a demarcation needs to happen. When the patient who is having flu symptom arrives at the clinic, we give out masks which are used for the patients to wear while they are sitting in the lobby, and it's completely, absolutely fine to wear a mask, because you want to protect people around you from getting the flu. You want to protect your family from getting the flu. There is no fun in getting a flu. Flu can make you very, 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 very sick. So the other thing is, the moment the patient comes in or the person comes in with these symptoms, we quickly try to get the person into the room, start the swab and check for the flu. And until the doctor arrives, already, we are not wasting any time. What's going on? The flu case has arrived. Let's take care of this. So that is very, very important, that you are not keeping that patient for a long area in the waiting area. You're going right in. Inside the room, again, there is a possibility that you could spread the flu by having sneezing or coughing on the entire surface of the cabinets. So it's very important that you keep the mask on. It's very important for the physician to wear a mask and the person who are taking vital signs to wear a mask to prevent any of the flu virus from getting, because the moment you're going to go and check and all the virus is load is put on the person when suddenly the person coughs. So it's not a good idea to reach out without wearing a flu mask. And these masks are easily available in every Walgreens, CVS or other stores. It's something that you have to keep at home as well. The next topic, you got the flu. What do you do from here on? So the you have tried preventing the flu, you have taken zinc. I believe in natural foods to be the best cure than taking a zinc pill. So I increase the amount of nuts, dairy, beans, eggs, lentils, various types of combination beans I eat, to have a lot of zinc in my food. And I try to eat a lot of fluids. I'm drinking like a gallon of water. To know how much water you need to drink, find out your weight in pounds divided by 2 is the amount of water, plus add 20 ounces for daily losses. And that's approximately the amount of water you need to drink on an everyday basis to prevent the flu. If your body is hydrated, it will not catch the flu. But still, you took the zinc, you took the vitamin C, you took lots of oranges, but in spite of that, you have the flu. What are you going to do apart from taking medications? You can have salt water gargle. What you can also do is, if you have nausea, crystallized ginger is available in the supermarkets. You can just go there and ask for crystallized ginger pieces. Keeping them inside the mouth will help the flu symptoms the nausea symptoms from coming on. These people can become very, very sick. So honey, or tea with honey and lemon, or peppermint, keeping a clove in the mouth can help suppress the cough than taking just a cough syrup, because these natural things can actually make you feel very, very good. When you have the flu or during the flu season, washing your hands with soap and water. You do not need fancy hand sanitizers. Yes, if you have hand sanitizers, well and good, excellent. But if you do not have, just an antibacterial soap and water, wash your hands for 20 to 30 seconds. And that's the minimum amount of time you need to wash your hands, so that when you are coughing or sneezing, you are washing the hands very, very well. So that brings us to a very, very important question, is when you are also doing this, you also want to humidify the air, increase the air circulation. When we are inside the room, due to the air conditioning, the air becomes very, very dry. You can buy humidifiers. They are available in supermarkets for $15 to $20. You can just run the humidifiers throughout the night, so your body doesn't become so dry that it catches the flu, or if you have the flu, the symptoms do not get worse. I use humidifier, period. 365 days in a year, I use a humidifier, because that's the way I know that I'll be able to breathe better in the morning, because the air has been moist throughout the night, and I try to follow that every single day. In every single room of my house, you'll find a humidifier. The foods that you eat. This is a very, very common question, Doc. What should I eat? We try to follow up a diet called BRAT diet. BRAT, BRAT diet. It is basically a bland diet, that you have bread, B for bread, R for rice, A for applesauce or apple. I would prefer applesauce, and toast. So this kind of bland bread or toast, rice, bland, mashed potatoes, applesauce will help you getting better. If you are eating highly spicy food, fatty food, it's not a good idea. You're going to get more and more sick. You need to eat a lot of fluids, including chicken broth or other sources of broth. Highly nutritious food, keeping the fluid intake very high. I would stay away from any kind of carbonated beverages if you have the flu. One of the very important questions and topic of discussion is the linking of flu to other diseases. Number one, stroke. The risk of stroke increases by 40%, 40, the first 15 days after a flu. That is a significant number. This study came out last year in 2018, New England Journal of Medicine, that within the year, the risk of stroke is as high as 40%. So a flu increases the risk of stroke. Similarly, a flu increases the risk of heart attack. Why does it happen? Because there is an inflammatory process going on in your body which causes the heart to go through a stress period or causes clots in the heart going through a stress period. So during this time, these vulnerable patients, diabetic patients or hypertensive patients are highly susceptible who are to flu. They're also going to get a higher risk of heart attack and stroke. But to me, 40% risk of stroke is a very, very high number. And I would treat these patients very, very sincerely, making sure they're hydrated, they have exactly the knowledge. We give out handouts of how to follow the bread diet. Another thing that can happen is you can catch other infections because when you have the flu, your immunity is low. If you are not resting for 48 hours and you're running back to work, and a lot of times when I tell the patient, return to work in 72 hours, the patient would say, I do not have any sick time, I'm feeling fine, I'll just take some Tylenol, give me some medications. No, you need rest. Rest is the main treatment. Fluids, rest, bread diet is the main treatment of flu. The antivirals can cut down on the duration of the flu, but rest is essential for two reasons. One, for yourself, and the other reason is you're giving the flu to so many others. I hope today's discussion of flu helped you in understanding a little bit basic things about the flu. If you have any more questions, please feel free to write in the comments below. Thank you and have a great rest of the day.